Dentigerous cyst is a developmental odontogenic cyst that forms around the crown of an unerupted, impacted, or embedded tooth. It occurs due to fluid accumulation between the reduced enamel epithelium and enamel surface. Let's look at the clinical features. It's commonly associated with impacted third molars and maxillary canines. Peak incidence is in the second and third decade of the life, and males are slightly more affected. Usually, it's solitary, but multiple cysts can occur in syndromes like cleidocranial dysplasia. Clinically, it may cause bone expansion, facial asymmetry, and tooth displacement. It's usually painless unless secondarily infected. In rare cases, impacted teeth may be displaced to extreme position like the mandibular border or sinus. Radiographically, a dentigerous cyst appears as a unilocular radiolucency around the crown of an unerupted tooth. If the follicular space is more than 5 mm, we suspect a dentigerous cyst. There are 3 types: central, lateral, and circumferential. In central, the radiolucency is symmetrical around the crown. In lateral, radiolucency appears on one side, usually in partially erupted teeth. In circumferential, radiolucency surrounds the entire tooth. A sclerotic margin may also be visible. Now, histology. The cyst wall is lined by 2 to 4 layers of non-keratinized stratified squamous epithelium. There are no red apex unless it's infected. We may find odontogenic epithelial rest and rustan bodies. In some cases, the lining may also show mucus cell, respiratory epithelium, or sebaceous cells. This indicates the cyst pluripotentiality. Due to the loose connective tissue, it may even resemble an odontogenic myxoma or odontogenic fibroma. For treatment, small cysts are removed by enucleation along with extraction of the tooth. Large cysts are first marsupialized to avoid jaw fracture and then enucleated. All tissue must be sent for histological examination. Complications include cyst enlargement, bone destruction, and rarely recurrence. There is a small risk of neoplastic transformation into ameloblastoma, epidermoid carcinoma, or mucoepidermoid carcinoma. And that's it for dentigerous cyst. Comment below for your next topic.